though.
And that's kind of late for Java.
I don't drink coffee.
No coffee, huh?
Welcome to Java with Jamie, episode number, I don't have any idea. It's really later here today, but I do have some hot tea. It's actually green tea. Re-energize is what it's called. So no more coffee for me. But we are live on Facebook with Dr. Dan Ritchie and Dr. Evan Osar, and today we're going to be talking about functional movement. So if you guys don't know them, these are people that you need to know in the fitness and health and wellness industry. So let's do a quick introduction. Dr. Evan, you want to go first?
Sure. Dr. Evan Osar with Integrative Movement Institute out of Chicago, Illinois, currently in Houston, Texas, however. And I'll be in DCAC or DC Reston area next week. So that'll be my trip on my way back home to Chicago, or not Chicago, Wisconsin. So my wife, Janice, and I own and operate Integrative Movement Institute, as well as we have a physical clinic in Chicago, Illinois. We educate health and fitness professionals about assessment, corrective exercise, and how to integrate this information into functional training programs, especially around this topic that we're going to discuss today, the active aging population.
All right, Dr. Dan.
Yeah, I'm Dan Ritchie, sitting in my office here in West Lafayette, Indiana. We have a personal training studio here called Miracles Fitness. And then I am the president and co-founder of the Functional Aging Institute. And we've been coming out to DCAC now since before the Functional Aging Institute even existed. So quite a few years now. Looking forward to getting back to live events, teaching several sessions, as well as a certification workshop, which I think is our first certification workshop live in person now for going on over 18 months. So it's been a while. Nothing wrong with virtual stuff like this, but I'm looking forward to a live event. So
for sure.
Well, today we are going to talk about functional movement health and why it matters. So if I was new to the industry or wasn't really aware of functional movement, how would you describe that in 5 short sentences? Dr. Evan.
5 short sentences. If I was to simplify it into one sentence, I would say it's really preparing the individual for the things they need to, want to, and ultimately love to do. Because as we age, it's all about getting ourselves into a position so that we have a quality of life and we don't go away from those things that we really enjoy, that give us vitality, energy, longevity, the things that we do with our families, our friends, the things that we just take for granted as young people, right? Me, a young person in their 50s, we take for granted that I just get up and go and just do whatever I want to do. And too many of our older clients, that's not their reality. So if we can help our clients with strategies, whether it be exercise, inspiration, education, to help them do the things they ultimately need to for everyday life, want to do, and most importantly, the things they love to do, be with their family, be with their friends, and be active.
All right, Dr. Dan, do you have anything to add to that?
Yeah, I couldn't agree more. For us, our foundation is need to do, like to do, and want to do stuff. And so that is somewhat variable depending on the person standing in front of you. And so I tend to define it based on what we call the hierarchy of physical function. And you want to stay in the top half. Do you have to be the fittest person on the planet at 75? No, but you can't be frail or even pre-frail, because then you're one accident, incident, illness, bump or push at the grocery store from real trouble, right? So for us, it's you got to stay in the top half. You've got to be independent to semi-fit to fully fit, or you're really not in a good trajectory of aging. And so we say you got to do everything you need to do to stay in that top half.
Okay. So tell us a little bit about, so sometimes on Java with Jamie, we just talk about different things in the health and wellness industry, but we are really talking about the DCAC Fitness Conference coming up in 10 short days. I'm so excited.
Crazy.
So why don't you, Dr. Evan, tell us about the sessions that you're going to be doing. And I know Janice is also doing a session, which is really popular. And tell us about those and who should come and why they should come. If you've watched our sneak peek videos, you've already heard this, but I think it's really relevant information that people in the industry can use.
Yeah, I really love the fact that you not separated, we're integrated into the event, but you set Dan and, Functional Aging Institute and Janice and I separately because we focus 100% on that active aging population. So if someone's looking or working with that active aging population, the older adult population, and they're looking for information, real world relevant information, because unfortunately what we see in our industry too frequently is an industry that's focused on younger people and doing, the HIIT workouts and getting a sweat going and all that. And that's great. There's nothing wrong with that. However, many of our older clients are coming to us and that's not where they're starting. And they're often intimidated by those type of workouts. And even though we can work our clients to that point, there needs to be steps along the way. Dr. Dan discussed that hierarchy and getting people to the higher level of that higher or the above that line of frailty, so to speak, where they're going to require a lot of assistance. And part of that strategy, I'll let Daniel, I'll let you talk about the higher level progressions, but part of that is preparing the individual so that they can lift, exercise, perform at a higher level. So there's things that we need to, number one, assess for them. So in our sessions, we're going to look at some simple, easy assessments. Even if you're working in the virtual world or you're still working in the online world, you can do these online and or in person. So you assess, so you see the strategy your client currently has. You use the most effective corrective exercises, which sets up the optimal habits, the optimal posture and movement habits that you will ultimately take into the functional exercise progressions. So Janice and I will look at female core specific to women who've had surgeries, pregnancies, traumas, things like that. We'll look at the rotator cuff. So clients that have shoulder issues, a lot of our older clients that can't get their arm overhead. So we'll look at common reasons why, how to assess and then how to address those issues around the shoulder. We have a session on the foot and ankle complex as well, because again, that's a connection to the ground that will set up the balance progressions that Dr. Dan will show us. And then we have a section on the hip. We'll talk about the anatomy of the hip and why some of the things that we learn and teach in the industry actually are incorrect and actually are contributing to some of our clients' issues. And this will, as I mentioned, really what Janice and I are setting up during our sessions is going to tie right directly into what Dr. Dan is teaching with the functional exercise progressions, with the group exercise, and how to get your clients to that higher level of function.
All right, your turn, Dr. Dan.
Yeah, well, I love that you set it up so really people can come to the 2 days and they can go to all of Evan and Janice's sessions and all the FAI sessions, and we're not competing, so they can get everything they need to really work with active aging clients well. I'm doing a couple business sessions. Best kept secret is the business sessions. People don't want to show up to the secrets of successful studios, but whether you're an independent trainer, a studio owner, in that session, I give people tips for how do we get more clients. You definitely need to learn how to train them better for sure. But if you don't learn how to get more, it doesn't really matter that you know how to train them better. It's like you need 3 clients, if you only have 1. And then in the other sessions, I'm going to be going over the functional aging training model, where we talk about why does it matter if your clients are in the lower independent category? And a lot of times they don't realize it. I think the vast majority of our population over the age of 60 is in the lower or higher independent category. They're not fit, they're not exercisers. And I think even the ones in the lower independent don't realize how close they are to being pre-frail. And this is why all of a sudden it's like, well, grandma was cooking Thanksgiving last year and now all of a sudden she's with a walker and she can't do that anymore. And it's like, how did that happen? Well, there were a lot of things. And so one of my sessions really walks through that and how do we approach that. And then Evan's actually teaching one of my sessions on balance circuits, which is all kinds of fun. 4 different levels of workouts. So you can see it's not a one size fits all, right? You can have a 70-year-old that's super fit and needs a really high functional level workout. And then you could have a 55-year-old comes in and they're limping and they, like just getting through a 30-minute session is going to be a challenge. And so you got to have those lower functional level circuits. And I've got a session on power training because I know some people are a little leery of, well, how hard do I train older adults? It's like, well, you still need power and explosiveness and speed, getting out of a chair and getting to the grocery store and carrying things and climbing stairs. And running with your grandchildren. So we'll do a session on that. And then I'm excited to do, for the first time ever, the caregiver exercise specialist session. Have never done that. And that's really focused on a much broader audience, not just fitness professionals, but really looking at what I think is going to be the next biggest challenge in healthcare. We currently have 2 million caregivers in the US, almost 4 times as many as personal trainers. And they don't have education or knowledge on how to do exercise with their mostly frail patients or not healthy patients. And so we're going to look at how can we add 10, 15 minutes of home exercise to retirement communities and assisted living facilities and in-home care, and really have an impact on the fall statistics in our country. So that's going to be an interesting session. And I'm hoping we'll have some folks in the DC area that are retirement community minded, that, are working with thousands of, really that lower functioning kind of pre-frail elder, because those are the people, the results are dramatic, right? I mean, if you're basically sitting most of your day and we now get you exercising 10 to 15 minutes a day, it's like, wow, I feel so much better. I have more energy. I can actually do things, and we can really change your quality of life.
I love that. And Dr. Dan, you are also doing a Sunday post-conference workshop, the Functional Aging Specialist Certification. And it's partially in person, but then you finish it off on your own. Is that correct?
Yeah. So our live workshops, I always tell people it gets you about 70% of the way there to take the test. But I'm not going to read the manual to you. That would be brutal in a live workshop. So you get kind of the best of both worlds. You get a live workshop where we get to go through all the hands-on stuff that are in the videos in the online course. So we cover about 70% of the material, but then you get the full online course too. You don't pay for that. That's just included. And then you complete that and you get the functional aging specialist. So they're going to get 8 hours for a live workshop, which I think we're going to get done in about 5 or 6 hours. And then they're going to get a full 15-hour online certification on top of that. So it's like 20, I can't do the math, like 23 hours of CEUs. So it's a great bang for your buck. And the live workshop's a lot of fun because we do all the hands-on stuff that are in the videos. And then you can always go back and watch those. When people are like, well, how do I do that 8-foot up and go? There's a video on that. How do I do that chair stand test? There's a video on that. So you can go back and watch it all again. And then get certified and get on our map so we can send you clients, because we have people asking for FAI certified trainers in all parts of the country and actually the world these days. We're now in 34 countries. So
wow, that's awesome. Okay, so at the event, just to recap, Dr. Evan, Janice, and Dr. Dan are all in the same room, the Lake Fairfax room. And one of the cool things about their room is I have asked them to live stream their event as well. So if you sign up for the live stream, it's going to be a little bit different than this. We're not going to be like face to face in the computer. It's more like I'll be back here with my screen and you will see me, but you will still get all of the education. So if you're not in the Virginia area, or it's too far for you to go, or maybe you're just not comfortable, you can sign up for the DCAC live stream event and catch all of their sessions that are happening on Friday, August 6th and Saturday, August 7th. And we will, of course, save room for questions and things at the end, but mostly you'll just be like a fly on the wall watching the conference happen. And there are several other sessions that are going to be live streamed as well. What else do you guys want to talk about?
how long you got? How long you got?
Like 6 more minutes before I gotta go run.
6 more minutes. All right. Well, I'll just say this. There's a great synergy between what FAI teaches and what the Integrative Movement Institute teaches. But at the end of the day, I always tell people this population is so big and so diverse. When we look at, there's over 100 million people now in the United States over the age of 55. And I always challenge people, how many fitness businesses, fitness studios, yoga studios, Pilates studios, throw them all in the mix. How many are really targeted at the 55 plus population? There's just not that many. We can throw a rock in probably any direction and hit a fitness studio or a yoga studio. But how many are actually focused on 60-year-olds, 70-year-olds, 80-year-olds? people that are starting to get into that balance and fall risk category. Where's the studio for them? Where's the health club for them? Where's the fitness program for them? So it's a huge opportunity that's not going away. In fact, it's only going to get bigger. Whether you want to do one-on-one training, small group training, large group fitness, online fitness, this is really a population you should be studying. And so between the 2 days, between what the two of us are going to cover, you're going to definitely get your money's worth. You're going to have better tools to train the clients you're training now and better tools to train the new clients. And if you attend the business session, you might learn how to get a few new clients so you can actually grow your business. Because at the end of the day, we want you to help more people, right? So my goal at these conferences, I want you to help more people. I want you to get better results for better people, but I also want you to have more clients and have greater impact. So if you have 5 clients right now, great. Let's get that to 8. If you've got 50 clients, let's get that to 80. And then of course, let's give you some tools to train them better.
Awesome. And I'll piggyback off that, Dan. I'm actually in, as you mentioned in the beginning, I'm in my good friend and colleague, Jackie Bachmeyer and Jason Eichen, their studio, Evolution Fitness and Wellness. And they have done mastermind coaching with the two of us, with you from a business perspective and with us from a functional assessment and corrective exercise and functional training standpoint. And they specialize, their specialty is the over 50 population. And, just this morning, I saw Jackie work with a woman that had like literally her entire half her pelvis and hip removed. She worked with a client like that, from because of cancer. She worked with another client that had, high risk of falling. She worked with her groups training. And one of the things that we teach our clients, and absolutely you should and need to go to a business session. One of the things that can help you get more clients, where Jackie gets the majority of her clients, is just word of mouth, because she does such amazing work with her clients. She has the expertise, not only as a business owner, she has expertise as a fitness professional who basically she remade her career. She started fitness training just 5 years ago, completely different career. She was in the art world, the business world before, changed her career. And 5 years later, like, she's amazing at what she does, working with high level. When I say high level, I mean like high complicated level of clientele, and being successful. And the greatest reward and the greatest way to build your business and to differentiate yourself from the rest of the people out there is just to do high quality work, which is what Jackie and her team, they bring me in, they bring you in, Dan, they bring other professionals in. I know our like-minded friend and colleague, Robert Linkle's coming down to do some training here as well. So if you, as Dr. Dan said, if you are looking to differentiate yourself, and the majority of fitness professionals listening to this and or in the industry, they're working with this population, the 50 plus, the clients that have a high likelihood of falling, high likelihood of having chronic joint issues, for having like decreased quality of life, sarcopenia from this entire 16, 18 months of quarantine. These are the sessions that will help you succeed with your clients, be very effective with your clients. And as Dan said, if you can pick up 1, 2, 3 more clients, you probably double, tripled, quadrupled your income just with a couple clients and a little bit higher level of skill. So I highly recommend, and there's nothing like learning in the hands-on live environment. If you're able and comfortable to do that, absolutely attend this, because we've been doing virtual for 18 months, and it's a great way to reach out and get CECs and get information. Nothing like the live environment to really learn, experience, and really soak in the information in a whole different way than just learning from in front of a computer. So highly recommend, if you can, if you're in the area, even if you can live stream it, just attend this event.
All right. Well, thank you so much for coming on today and talking about your sessions. I know this, like you said, it's a growing population and we can all get more educated. That is my whole purpose with the DCAC event, is to provide a platform where I can bring in the educators so that everybody can keep learning. So I appreciate you guys coming on today, and we will see you in 10 days.
Yes.
All right. See you
guys. Have a great day.